Welcome back to Montana This Morning on this Friday. Joining me in studio, we have Dr. Sarah Sample Eppinger, and you're with Billings Clinic.
I am.
Tell me what you do.
I'm one of the podiatrists at Billings Clinic. Okay. So I'm one of the 4 foot and ankle specialists that we have at Billings Clinic who work with patients with foot problems of all kinds.
Okay, so one of the big reasons that we have you on the show this morning is it's PAD Awareness Month.
That's correct.
And we're learning a lot about this subject this week. Talk to me just briefly about what PAD is.
So peripheral arterial disease is poor blood flow from your heart to the tips of your toes. It can make you uncomfortable, it could cause wounds, and it can lead to amputations,
wow,
which is the part that we really get concerned about for folks.
And there is a concern about that, and you told me something pretty alarming just a couple minutes ago about amputees.
Yeah, so Montana has one of the highest amputation rates in the country every single year.
Had no idea.
Yeah.
And the cause for that?
Is usually peripheral arterial disease and or diabetes. We have really high rates of both in Montana.
Wow. Okay, so your job is to kind of help people before they get to that point. Is that right?
That's the goal. So in my ideal world, we catch everybody with peripheral arterial disease before they ever end up with a wound. But unfortunately, most people who come see me already have a wound. So our goal at Billings Clinic with our podiatry team and our wound care team is to prevent people from getting an amputation in the first place.
Okay. Kind of talk to me about how that process works a little, because it seems very complicated, but you can actually save a limb.
We can. So it's a multi-specialty team approach, and we have all of the pieces to that team at Billings Clinic. So it involves wound care in our wound care center. It involves seeing our vascular specialists, whether that's a vascular surgeon, a cardiologist, an interventional radiologist. It involves using hyperbaric oxygen therapy to help improve blood flow to the limb, all with the ultimate goal being that you don't lose the leg in the first place.
That's amazing and fascinating, and we're learning so much about that. Just briefly though, Sarah, can you just, what should people watch for if they think that maybe this is something that we know about the swelling, right? We know, but you talk about a wound. So what kind of a wound are we looking at?
So anytime you have a cut or a sore or an injury maybe that is not healing the way that you would anticipate it to, meaning it looks infected, it's turning black, you have color changes associated with it, or it's just not responding to the wound care you're doing at home, the sooner you come in, the less likely you are to end up with an amputation.
Okay.
So you don't want to sit at home on a wound for months and months and then end up in the hospital when it's infected. If it's not healing in a few weeks, it's not looking better, you should go see your doctor.
It could be P.
Because it could be complicated by peripheral arterial disease.
Okay, all right, okay.
Yeah.
Thank you for being here this morning. We're so great to have your expertise and all of your knowledge. We appreciate what you do.
Yeah,
all
absolutely.
Right, and we'll be right back.